So, Dr. Pla, thank you for coming. I really do appreciate it. It's a pleasure to see you too.
Thank you so much.
Thank you so much for coming out.
It's a pleasure to come here and address the city of Chicago about preventive medicine, and a very important topic that I think affects the whole community in general, and especially, I think very key to the Hispanic community is the relationship between obesity and diseases. A couple weeks ago I was having a conversation with one of my colleagues, Dr. Arturo Oliveira, who's also a Hispanic care physician, and we actually were talking on the radio about obesity and how it's implementing our society, and it's growing in large numbers, and how it's implementing disease. One disease in general is cancer. My wife and I, Dr. Helen Ruiz Pla, have been taking an active role in trying to allow our patients and our population to know that we implement nutrition as part of treatment of diseases. I was on the phone this morning with a colleague, a friend of mine, a breast specialist down in Austin, Texas. His name is Dr. Owen Winsett, and we were discussing a topic that was published in JAMA, which is one of our medical journals. In 2006, they have been following women over the age of 50 who were not receiving estrogen treatments. They weren't receiving hormonal treatment, and they were following women who were overweight. And they came out with a very interesting analogy that by being 1 pound overweight at age 50, you increase your risk of a breast cancer by 1%.
Yeah.
And that's a big number. But the interesting component is that if we implement weight loss and treatment in women over the age of 50, for every pound that we allow them to, that we help them lose, so let's say an example, 10 pounds, we reduce their risk of breast cancer by 2%. Wow. So it's 1% for being over a pound, but that, the striking number is that if we're able to reduce weight, that we can reduce the risk of having a breast cancer by 2%. So that means that if we can get somebody who's overweight 20 pounds and they lose those 20 pounds, that's a 40% reduction in breast cancer.
But Dr. Pla, I mean, we did have the scare at one time about the hormone therapy.
Right.
Now, how does that play a role into this today? I mean, a while
ago, we're not doing hormonal treatment, and I agree. I mean, the hormonal treatment has its it has its controversies. I mean, the NIH did a very large study, and they basically came out and they have warned us that hormonal treatment may not be the best. I know that as far as preventing heart disease and as far as protecting bones, there are better products than hormones. So we try not to use estrogen treatment. These women in these studies were not using estrogen treatments. They were not receiving estrogen. They were 50. They were 50-year-old females who were overweight, not on estrogens. They were being followed by their doctors, but they were also being followed long term to see the risk of obesity versus breast cancer. Sure. And so in that sense, it's a big deal. Now, I think we have to be careful with hormonal, but what we have to implicate is that it's very important to get in touch with your doctors and include nutrition into your treatments. I think that we need to eat more balanced meals. We need to exercise more. We need to walk more.
Dr. Pla, I have to interrupt. You're on a roll here, and that's great because you're giving out so much information. But we always talk about balanced meals. We always talk about what we should and shouldn't do. But then, if you look at our community, especially, I'm referring to the Latino community and other cultures that are out there. I mean, we talk about nutrition, balanced meal. What's a balanced meal for one culture is not the same as another. I mean, how do you break that out?
Well, I think that a balanced meal includes that to be careful. I mean, all cultures eat carbohydrates, and I think we have to be. I think we have to be a little bit more conscientious in eating less carbohydrates. I think that's why the incidence of diabetes is so high among the Hispanic population, is because they we eat too many carbs.
Right.
We eat complex carbs.
Give some examples, because we talk about carbs in the health when we're in the health arena, but the individual who is not familiar with that terminology and has to go look it up or has to read about it. I mean, you and I know what carbs mean, but let's give some examples to the persons watching. What are some examples of carbs?
Well, simple things. Basically all our cereals, our oatmeals, all our bread groups, all our pastas. Our rice, carbohydrates,
anything with flour, right?
Any flour ingredient, potatoes. So any type of root or starch. We the Americans like to eat potatoes. We Hispanics have a bunch of different roots. Verduras that we say that are also have to be considered. So we have to try to eat less of these, and we really should try to make an effort not to eat combinations of carbohydrates in diets, and it's very typical, for example, to eat rice, beans, and a tortilla. Well, those are three, the beans are a carbohydrate, the rice is a carbohydrate, and the tortilla is a carbohydrate.
So the whole dinner is just turned into a whole carbohydrate dinner.
So we need to try to to make an effort of eating less of that. And if you're going to eat that, you may want to then be vegetarian that day and don't include a meat in your diet if you're going to do that. But most of the time we do implement a meat as well. So I think that's one of the things that we have to do. Now, there are ways that you can try to improve your carbohydrate management. There's a nutritional product, and there's various out there. We have one in our office. Based with chromium, and chromium is a product that helps you break down carbohydrates. Wow. Chromium is something that is deficient in our diet because we eat so many processed foods. But chromium is something that allows your body to take a sugar, break it down faster, use it more for energy, and help us break down fat. We implement this in our office. We have a product called Lipotrim that is, I'm not sure if I'm allowed to say that, but, the main ingredient is there are products out there that do have chromium, and chromium is something... but
chromium is this main ingredient in regards to what the product is. I mean, if it's the main ingredient to a particular product, is this bought over the counter? Is this something you can go look for at a pharmacy?
You probably can get chromium in nutritional stores. The various stores that are out there. I mean, there's different high grades. I mean, so it may be something to talk to physicians that are involved in nutrition. I have a colleague of mine, Dr. Octavio Lopez, who also does weight loss therapy, and I know that he implements this product also in his practice. But I'm not saying that you have to come to our practice to get this. I mean, but chromium is something. If you go into the various vitamin stores that are available throughout Chicago, that's something that you can implement there.
But obviously, the best thing is to talk to your doctor about it.
Doctors who there are more and more doctors are becoming interested in nutritional and weight loss, in Chicago, and if your doctor's not familiar with these, then you may want to ask around. But I think that there's ways that we can definitely improve, how we eat our food. I mean, we like to tell people to exercise and stuff like that, but again, being overweight is not always makes it hard to do exercise. But walking is an exercise that we can all do, and I think that's when I was speaking with Dr. Oliveira last week, we said that how important it was to walk. I mean, we get home a lot of times and we sit down and I think we need to walk. We need to walk a little bit. In last year, I had the pleasure of going to Europe, and I was in Rome, and I was surprised the amount of elderly people that were riding bicycles and walking. Something that we don't see that here. I think when I see an elderly person here on a bike, you're surprised. Whereas in Europe, it's the standard.
Absolutely.
It's the standard, and we need to kind of implement that in our society.
Well, I agree with you. 3 months ago, I started walking, and I'm walking. I started 3 miles a day, every day. I'm up to 7 miles a day.
That's good.
And in 3 months' time. So
that's good.
I went from 3 miles to 7 within 3 months.
It's possible. It's possible,
yes,
and I think that you have. What I tell patients is that if you're going to start a walking exercise or power walking or something aerobic, give yourself a small goal. Try to try to start with even 10 or 15 minutes, okay? And if you think, if you did 10 minutes and you were tired, then maybe the next day that you do it, start with less than that. But as you said, you started with 3 and you went to 7. So the goal would be to increase your duration, whether it's minutes or distance. We can always do more. And if you do more, your body will start burning calories. And that's a trick to doing this. And I think we have to attack it because it's not only obesity and breast cancer. It's also associated with colon cancer, both in men and women. And by far, it's an independent risk factor for heart disease. You know, people are dying of heart attacks because they're overweight. It's no longer something that you need to combine it with another risk factor. It's an independent risk factor. And the biggest culprit out there is diabetes and metabolic syndrome. I mean, obesity is a big link to those two keys. And the incidence of diabetes among the young population in our country is increasing, and especially in our Latino community. It's getting bigger and bigger. And these are not juvenile diabetics. These are juveniles that have adult diabetes.
Dr. Pla, I want to keep going. We started a little late, but I want to make sure that we have you come back so that we can talk about this. There's a whole lot more to talk about. But on that note, I want to thank you for watching and thank CAN TV, Illinois Masonic Hospital. Our guest today, Dr. Ramon Pla of Gottlieb Memorial Hospital and a physician of Hispano Care. Thank you for watching CAN TV. Until next time, we'll see you soon. Thanks.
Thank you very much. Goodbye.